Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hi, welcome to Ilanomics. There are barely 4 days left for the end of the 21-day lockdown announced by India to try and contain the coronavirus from spreading. All the talk now is about how to lift the lockdown, what measures should be kept in place, what restrictions can be lifted and cannot be or should not be lifted. Is there a strategy, and if so, what should that strategy keep in mind? Professor Ila Patnaik will tell us. Hi Ila, we are back to talking to each other on SimSat because of the restrictions, and we are doing this remotely. So thanks for doing this from where you live. So you have written this week, Ila, about the key strategy that should be in place on lifting or before lifting the lockdown. What should be ensured? Can you explain to us what you say is a partial lockdown or a cluster containment strategy?
So it's not clear that the lockdown will be lifted right away. It might be some time. Some states want the lockdown to stay in place, and in fact the strategy might initially be to just contain the disease in clusters, the virus in very, very tight clusters where, like the Bhilwara model, where they don't allow people to go out. But the question is, eventually, the longer you keep the economy in a lockdown, and when you uniformly isolate everyone, which is what pretty much we've been doing in this 21-day period, then the economy starts hurting, and you have to have that balance, and that is why we have already started thinking about how the lockdown can be lifted. Of course, there are health concerns, and so the question is, what sort of a balance can we think of so that we do less damage to the economy? Now, there are really two kinds of strategies that people have talked about. The first strategy, which we had also discussed in the previous episode, last week we were talking about it, is one where you might want to, if you have absolutely no, let's say you had no vaccine, let's say you had no treatments, and all you could do was social distancing for the entire economy, then you would do it for a period of time, maybe lift it for some time, and then do repeated such cycles till slowly people became immune to the virus, and that would have to be done again and again. Now, there are two constraints India has when thinking of that strategy. The first is the large size of the population, and the second is the very limited healthcare capacity, ICUs, ventilators, hospital beds, doctors and nurses that we have. Now, given that that is our main constraint, perhaps that's not a sustainable strategy, because how long can you go through this cycle of shutting down and opening up and shutting down and opening up? You could be doing it infinitely, given the size of our population. By the time we want to get herd immunity for everybody and we want to go down this path, and the opening up is for trying to treat patients and rescue lives. So it's a very difficult strategy, and there are economists, for example, Paul Romer, who was the 2018 Nobel Prize winner in economics, who has argued that instead of trying to do that, what is a more sustainable strategy, not just because the economy is important, but a strategy that attacks the virus as well, would be what epidemiologists have been saying, to bring down the R0, or the reproduction rate of the infection. So that strategy involves saying that at present, how many people get infected by one person? So R0 represents the number that each individual would infect. So currently it's about 2 to 3 people, let's say, and you need to bring that down to below 1. That means one person will infect less than one person. And how you do that might be that you do so much testing and you try to isolate the people with the disease. So in contrast to the universal isolation, the uniform isolation that we are doing now, that even though we are not infected but we are in isolation, we instead try to isolate those who have the virus, for which we would need to do a lot more testing. And then the strategy really turns to that, you spend a lot more in testing, you identify who to test, what is the most effective way to increase the yield of your testing. How do you, with your limited facilities, even testing facilities, India is not going to have infinite facilities. But, in terms of thinking of a path that we go down through, so from the extreme lockdown to partial lockdowns to slowly preventing things like large congregations and public meetings and so on, in eventually to one where anybody who's infected is kept in isolation. And if we think about that path and think through that path, then the strategy that can be sustained is one where we would be putting a lot more resources and emphasis on the testing strategy.
So you're saying, like, in a sense, how the government is now moving, or at least in some parts of the country, moving towards a partial lockdown or a selective lockdown. There should also be selective testing of particular groups of people.
So you can do testing of groups of people and you can do individual testing. So for example, if you do groups of people, let's say, it could even be that in an area, if in a district, in a pin code, if you think that there is a virus here, you could mix up their samples and do just one test. Then you would know, this is a pool testing strategy. You would know whether there is, the virus is there or not. Alternatively, what you could be doing is that depending on high risk cases, so some occupations, some regions, some activities may be high risk. So the top of that priority list would be healthcare workers. They are at high risk. They are most exposed to the virus compared to anybody else. We've seen how doctors have been falling ill. Healthcare workers can be tested. And another point that is made is that it's not just that healthcare workers are at high risk, they are also at high risk of infecting others. They're at high risk of infecting their colleagues who are, our corona soldiers, who are the ones who are actually very, very important in fighting the disease. So in the strategy, Romer suggests, for example, healthcare workers, sanitation workers, grocery clerks. He's talking about the US economy. But I think in terms of the principle, there's a very important principle there, that what we've been doing so far is fine, which is what we've been doing, given the very, very few and limited testing capacity that we have. We've been doing symptomatic patients, those with travel histories, and those with contact tracing. There we try to find out if any of those people have been infected. But in addition to that, it is important also too, because as community transmission starts happening, contact tracing becomes more and more difficult. And so, how many people will you trace? So there, the suggestion is that perhaps what gives you a higher yield of your testing could be high risk occupations, regions, and activities.
Ila, you've also talked in your column this week about separating, say, the urban populations and rural populations. For instance, you say that urban populations are more at risk and should be probably isolated and kept away, while you can allow some kind of economic activity and agriculture to resume in the countryside. What is the logic there?
So the logic is again risk. So, I'm not talking of now while we are in the lockdown, but when we think...
going forward.
Yeah, exactly. Going forward, when we are thinking of based on what principles will we choose where should the opening up happen, then it is perhaps those places which are less at risk and which are more essential. Now, agriculture fits both. So if it's time for harvest, you can't really postpone that very much. And also that you can do social distancing. Now, going forward from just the farm, you might need to put in many more norms in place before you can, in the mandis, in markets. So it's not just opening up the whole food chain mindlessly, but the places like the farms where there is low risk can be opened up. Also, if we are going to look at pools of and test pools, then perhaps today that can be done to first ensure that when you are opening up, or let's say you're letting people come to a mandi, then you do have the virus has not spread there and doesn't then affect everybody.
This whole argument about the timing of the lockdown, has a country done it too early, or has it done it too late, or has it done it right? There have been some countries, especially in Europe, where the talk is that they did not do it in time. What do you have to say about the fact that India started it when it did?
So I think India did it at the right time. Many of my colleagues disagree with me because the economy is hit very badly, and it has been argued that perhaps it should have been done much later when the risk of infection was higher. But I think that what was happening was that countries like the UK and Italy thought that their health systems could cope, and so they could allow some herd immunity to develop, and if people became ill, they could go to hospitals, and they had the ICUs and they had the ventilators, and so they they could even think of not shutting down too early because they had good health systems. I think our issue was that we knew right at the beginning that even if there are a few hundred cases in most of the country, the health system will not be able to cope. We didn't even know where the health facilities were. We didn't know where the virus was. And in that sense, to try to just say, let's just freeze, let's assess where our capabilities are, let's assess where the virus is, and only after that has been done do we try to have a strategy of how to cope with it. So I think that it wasn't too early in that sense.
And then the inevitable argument of when to lift the lockdown, or how much of the lockdown should be lifted. For instance, the latest from Europe again has been that Italy and Spain are having a rethink because their infection levels are rising again after a sort of a lull. So Romer, you say, has argued about locking down, opening, locking down again. So these on and off disruptions may actually do more damage.
Yeah. So the on and off disruptions, if you think about the one big crisis that happened, the 2008 crisis, then say for the US economy, GDP went down by 7.5%. And it took about 18 months for unemployment. Unemployment was at 5%. And those were considered big numbers. Now, what we are seeing now is that more than that damage has perhaps already happened. The numbers haven't come in. We don't know what the exact numbers are. But the sense of a lot of economists is that that much damage has perhaps happened in 1 month, just in the month of February or March when the lockdown started happening here. If these lockdowns are lifted and the disease spreads again, and you have to go through this process again and again, many businesses will be destroyed. And the longer the periods of lockdown are, the disruption to businesses could mean that then the GDP doesn't go back up. It really settles at a lower level because you've just destroyed the capacity of the economy to produce, to organize itself, to produce goods and services. So this is something that is worrying economists around the world in every country about how to tackle the economic impact of the lockdown.
So the consensus is test, spend money on testing and isolate, uh, segregate populations and slowly resume economic activity. Would that be right as some kind of a conclusion, Ela?
Yeah, I mean, nobody's saying do it exactly tomorrow because we are not there on testing. Nobody is there on testing. I mean, India is, of course, very far behind. Even if we ramp up our capacity hugely, we are still very, very far behind. But almost nobody, I mean, Iceland can, with a very small population, maybe test everybody. But in most places, the tests are yet there aren't enough testing kits to test everybody, which is why I think the discussion still is, can we test high risk populations? Can we do pooling of tests? There are other suggestions as well where people have said maybe we test the sewage because this is also the virus is also transmitted through fecal matter. So can we test sewage of a city? So there are various ways that people are thinking of so that you can test whether the virus is there or not. In addition to that, people are also talking about how we might make it easier to do sampling. Because today we are still following old methods. Maybe a saliva test works. So there is research needed there. There are other people who are saying that, maybe it's not so bad if there are a few people who, when they are tested, the test appears to be negative. The test says negative, but they were actually positive. Because to some extent, you can allow that if your strategy is to bring your R0 to below 1. So we are not, our strategy of bringing R0 to below 1 means the disease will die out. But at the same time, it is not that the economy will die out completely if we go adopting the other strategy. So I think increasingly, as we are seeing the effects of the lockdown, as many economies are thinking that there will actually be a contraction of GDP because we've just stopped doing anything. So, if this continues for a quarter, then suppose GDP is down in this period by half in that quarter, in the present quarter, then in the full year, it's, down by 1/8. So people have now started thinking this is not sustainable. Getting herd immunity by repeated lockdowns may not be sustainable. So maybe even spending 1%, 2% of GDP on testing and on doing more research on testing, on prioritizing testing, may actually give you higher returns than the strategy of completely shutting down and not spending that money. So it's really this sort of focus on testing. I think the Supreme Court that has said that testing should be available, the spirit of that was that testing needs to be given priority. I just think that we have to make it a sustainable strategy. So if we are co-opting private labs to do testing, we have to make it sustainable for them so that they have the financial depth to buy testing kits, to pay their workers, to buy the protective equipment and keep their labs running. And I think if as we move ahead, the more the money spent on testing and on creating the sustainable ecosystem where private labs are given the money to continue with the testing and to put out free tests, whether we could do it through voucherization so that it's not that everybody goes and starts doing tests and we run out of testing kits. But that strategy will increasingly gain currency, and that may become, in the long run, sustainable, the most important strategy that we have against the virus.
So invest in testing, make it sustainable for private labs to test, allow the government to pay private labs, and this will bring returns in the long run. That's the thought a couple of days before the end of the lockdown, if the lockdown ends on the 21st day. Thanks for watching this episode of Ilanomics. We will be back with a new one next week. And thank you, Ila, for doing this. And please do subscribe to our channel, Print YouTube channel, and also send us your comments. Thanks for watching.